Madam President, the House of Representatives Paul Ryan Tea Party budget privatizes Medicare. Let me repeat that. Medicare, the program of medical care for senior citizens that our seniors have come to depend on. The House of Representatives Paul Ryan Tea Party budget privatizes Medicare. Now, this is not an empty threat. It's not this senator's or many other senators' political interpretation. The House Republican Budget Committee chairman's budget would end Medicare as we know it. It ends Medicare. It hands seniors' health care over to insurance companies. It would break a sacred contract between workers who paid into the system thinking it would be for them when they retired, but under this new scheme, senior citizens won't have a Medicare program anymore. They would have to pick an insurance plan, and a voucher would be given directly to the insurance company. Under the proposal, I'm not making this up, a voucher paid for by the federal government would be given not to the senior citizen to go shopping. It would be given to the insurance company that they chose. Medicare for senior citizens would be turned over to insurance companies. If this sounds incredible, it is. Because under that plan, insurers would decide what doctors seniors get to see and what health benefits get covered. Now, why do I say that? Well, that's what an HMO is. An HMO is a health maintenance organization. That is an insurance company. They have a panel of doctors. They have a panel of hospitals. They determine what is in the coverage that a senior citizen gets. Contrast that to Medicare now. That Medicare fee-for-service, the senior citizen makes the choice of their doctor of what are the things that they look for in their total medical care, paid for because they are a senior citizen and are eligible to Medicare, of which they have been paying in all of their life through a Medicare tax. And so now this proposal is to privatize Medicare, take it out of being a government fee-for-service plan, and instead insert it into a privatized insurance company. Do senior citizens want to change their Medicare and turn it over to insurance companies? I don't think so. If insurance plans raise their cost, which we know they do, seniors then would have to pick up the bill. Seniors would have to pay more out of their pocket for this voucher program. And according to the Congressional Budget Office, out-of-pocket cost, this is according to CBO, the nonpartisan actuarial accounting organization. According to CBO, out-of-pocket cost would more than double for seniors. So the Congressman Ryan Tea Party budget does little to address the deficit while making every single senior citizen in this country get their health care from an insurance company. So that's why Senator Baucus, our chairman of the Finance Committee, and I have introduced a resolution. This Senate resolution calls on the Senate to oppose this radical voucher program. Medicare has been providing affordable health care for seniors and disabled Floridians and Americans for decades and decades. It is a very popular program with our seniors. Medicare should not be dismantled. It should not be turned over in a voucher program to insurance companies that will eliminate choices. It should not be turned over to insurance companies that will increase cost. And certainly, seniors' health care should not be turned over to insurance companies. Madam President, I yield the floor.